First, everyone is muted on entry, so please do use the chat box to make comments or ask questions for our panelists. And be sure that when you do so, that you mark all panelists and attendees from the drop-down box so that everyone monitoring and attending is able to see your comments and questions. As I mentioned, we are on a tight schedule, so we will start and end right on time, so you have enough time to get to the next session. This particular session is eligible for Certified Health Education Specialist CE, as well as continuing education credits from the Medical Library Association. At the end of each day, we will be sending out an evaluation form for you to complete, and this is the first step that you need to take in order to claim your CE credits. And finally, this session is being recorded, so it will be available for future viewing. And with that, I'm going to be turning it over to Heather Brown, who will be moderating our session today, which is titled Learning from Community Leaders, COVID-19 Awareness, Vaccination Attitudes, and Health Literacy in 5 Racially and Ethnically Diverse Communities. Take it away, Heather.
Thank you, Derek. It's a wonderful opportunity to be with you here this morning, afternoon, wherever we are at within the nation. I'll take a brief moment and introduce you each to the amazing community leaders that represent Community Faces of Utah here in Salt Lake City, Utah, that represent beyond Salt Lake, but that's where we're coming from today. First, I'll introduce Doriena Lee. She is a member and program coordinator for Calvary Baptist Church. She serves and advocates and leads efforts for the African American community. Valentine Mukundente was born and raised in Rwanda and came to the USA in 2000. She is the executive director for Best of Africa, a volunteer community-based organization for African immigrants and refugees of Utah with a 501c3 status. Then we have Ed Napia. He was born in the, go ahead, Ed. You're on mute.
I was born into the Tefu and Tepopoto Hapu, or sub-tribes of the Ngāpuhi Iwi or Ngāpuhi tribe from the Taitokero district of Aotearoa, New Zealand, where I was born.
Thank you. We'll hear more from Ed here shortly. His work experience has included activities among Pacific Islander Americans and American Indians and Alaska Natives. We also have Jeannette Villalta, and she is originally from Guatemala. She has worked as a community health worker for the past 20 years. She works as an independent consultant for different organizations such as the Hispanic Healthcare Task Force and Alliance Community Services, Multicultural Counseling Center, University of Utah, and more. Welcome and thank you, everyone. And I will go ahead and pose our first question. And as I do, I encourage each of these amazing CFU Community Faces of Utah leaders to give a brief introduction of more detail as it's appropriate to regarding the questions. I would like to talk first today about what health disparities have become more apparent because of COVID-19. And as you answer that question, go ahead and provide that introduction context of the community you're representing. So again, what health disparities have become more apparent because of COVID-19?
Okay, let me start so that we don't have any dead time. As was alluded to in my bio, I occupy a fairly unique position. I actually work at the Sacred Circle Health Center, which is owned and operated by the Confederated Tribes of the Goshute Reservation here in Utah. But I'm also a Pacific Islander by birth, being a Maori from New Zealand. And during the span of my life here in Utah, I've been able to move through both communities, in part because I was unofficially adopted by a family from the Northern Ute tribe here in Utah. You know, as we've been dealing with COVID-19 since March of a year ago, and in fact, my agency was one of the first to become involved because our youth were exposed to a member of the jazz team who the very next day announced that he tested positive. And so this was back in last March. So we were aware of it from the get-go. And it's been a little bit of a struggle, but at the same time, I think the other members of our panel would agree with me in saying that actually, were it not for COVID-19, many of the health disparities and the health experiences that our communities have would not have come to the public forum. I'm very happy for that. And I know, for example, Jeannette is going to be one that's going to be able to tell you that, you know, throughout our entire experience living here in Utah, our communities have had very limited health access. That's the first thing, and for a variety of reasons. And COVID has made that very apparent. And I'm sorry, I can't state the statistics, but yesterday I was listening to the news, and there are two areas in Salt Lake City which are predominantly minority, and that's the Rose Park area. And if you compare, Jeanette, what was the other community? I know Rose Park was one, and was it Glendale?
Glendale community.
Yes. And so, you know, I was listening to the news, and they compared the vaccination rates between Glendale and Rose Park and the avenues, which is more affluent, and it was about a 50% difference. You know, half the amount of people in our areas had actually had the vaccine. So we are immediately aware of the fact that our communities, for a variety of reasons, have very limited access to healthcare. Did you want to add to that, Jeannette?
Thank you, Ed. Yes, I'm agree with you, the limited access. And, you know, I know there is so many efforts for people to get access to the vaccine right now. We're talking about right now, but what is, they don't think ahead of this is in our communities, for example, the access to technology or the use of technology is very limited. It doesn't matter if you have 1,000 vaccines out there, if people cannot have access, if they don't have internet, if they don't have a computer, if they don't have, you know, we are doing right now registration for vaccines, and we find people that they have a house telephone. They cannot receive a text with the code that they receive for the vaccine, or people that have maybe cell phones, the basic cell phones where they only receive a call, they cannot receive text, or they cannot have access to another computer. And this technology literacy is a huge barrier sometimes for our community members to get access to the vaccine. And as you were saying, we as a community health workers and people that works in the roots in the community, we were aware of this disparity for years, right? And we are trying to connect people with resources, and we're trying to bring this to the table, and let's do something else. But the pandemic has to happen for all this disparity to resurface. It's not like the surface, it resurfaced because it's been there for years, right? And then we crash into this wall where, for example, the easy things right now is this law of the English only that is here in Utah. That was a huge barrier for have access to different language, all the information in different language, because the law says this English only, and all the government education and information needs to be in English. And that was a huge barrier. And then all of the organizations and people that work in the community, we have to advocate for this, even volunteer ourselves to do this and ask for that information in our own languages. And fortunately, it happens, right? It happens because of the advocacy that so many groups did. We have that access in different language, but it's not just language, technology, but it's the access to health. And we can talk for hours about all the disparity that happened with the pandemic. And I think this was a learning lesson, but we have to remember what happened during this pandemic, because at the beginning, we provide so much feedback about how we are working in the roots. But when the vaccine came, the same mistakes started doing again, right? it looks like we didn't learn anything from the beginning. And that's why it's so important to remember every step that we are been doing right now, and have this in mind for continue working with our communities, right?
Thank you, Jeannette.
Could I add a little side note, because I think it needs to be mentioned, talking about technology, you know, throughout the nation, most of our youth, right, our children were going to school virtually. A lot of our families could not receive broadcasts. So immediately their educations were interrupted. And I wanted to tell you something else here that I shouldn't dominate, but the fact is that even with our Latino communities and our other communities of color, the employers weren't taking care of their employees. They weren't enabling them to work safely. And that's why a lot of our people came down with COVID, and I better put my mute button on.
Thank you, Ed. Valentine, I'd love to hear your thoughts on how the health disparities have become more apparent because of COVID-19 in your community. And please go ahead and provide more introduction of Best of Africa.
Okay, thank you, Heather. So Best of Africa is a community organization made of African refugees. Some of them are new to this country. Others have been here for a while. And that makes a difference in terms of what health disparities and other challenges they face. So I agree with what Ed and Jeannette have already talked about. What I can add, especially for the refugee community, is I know many people in this country lost jobs because of COVID, but when it comes to the immigrant, especially refugee communities, this is already a challenge even before COVID, that it's already hard for refugees to find a job in this country because of the language, transportation. You can imagine when you are new, so many things, a barrier towards your success. So finding a job, a good job that gives you enough income was already a challenge, but after COVID, that became worse. The other thing is because of COVID, people have the social distancing rule that had to happen in different companies. And many of refugees work in production areas where you are in line. Now you can imagine if you have people working in a production line, social distancing is already a challenge. So that's why some of the companies had to send people home or reduce the number of people going to work at the same time. The other thing is all that created stress and depression, which led to mental health. There has been a big increase in mental health problems in our community. And the fact that mostly Africans, normally we like socializing. That's how we live our life. We like getting together with friends and family members. So because that has not been happening, people are just stuck in their own home by themselves. So that lack of socializing increased the mental health problems.
Thank you, Valentine. Doriena, what are your thoughts on how health disparities have become more apparent because of COVID-19, and also what you have had to, how the initiative was created because of what needed to be done in behalf of the community and the part you played in that?
Good morning, everyone. Thank you, Heather. It has played a great deal of great hardship on the African-American community because our way of getting around and communicating with each other is mainly through the church. So when the churches were closed, we had a lot of people that went through a lot of depression. I have to agree with what everyone else said about getting to the doctor and the disparities that come there because they couldn't go for not only that was because of before COVID, But now that we've had to interact the way we've had to our community, we found a lot of disparities that are in the home, lack of finances, lack of insurance, the food problem. So we've had food banks and different ways of getting people what they need. But the main thing was them having not being able to go out to socialize. Socializing is a very big part of the African American community. So when it came down to the COVID, a lot of our people were skeptical about taking the shot. I'm sure you all know about the Tuskegee thing, so they're thinking this is another Tuskegee thing. So half are on board about getting the shot, and the other half were saying no, we don't want the shot. So the ones that wanted the shot were having difficulties getting the shot. So with our the help of CFU bringing me into meeting someone, we set up a site at Calvary Baptist Church for people to get a shot. And so it's been going very well. And Jeannette and Valentine has also been very active in helping to get their people vaccinated through that. So we have a good chance of getting most of them vaccinated, but we still have a long way to go about the ones that are straddling the fence about should I get it or should I not. So we could say about half of them are on board and the other half we have to get on board because they're not willing to take the shot. They're afraid of taking the shot. So, excuse me, I'm sorry I didn't tell everybody not to call me. So anyway, we are still actively signing people up, and they don't have to necessarily be African American. It's for all the community because we are a community-based church. So we take everybody, and the church itself is a very integrated church. So we are working very hard to help the people that are having the mental meltdowns of not being able to go out. And that is a big, big, big problem with us right now.
Thank you, Doriena. And I believe everyone's pretty modest here on this panel. I do want to mention that Doriena has worked with the Department of Health and initiated a vaccine clinic that occurs. And the call that she just silenced was, I'm sure, an appointment. So people are calling her directly to schedule their appointment
Right.
to be able to come to the church and have that vaccination. That's very powerful. And it does take these community leaders that are here today to lead that effort. They are volunteers. They are doing this out of the passion and ownership of the community. So, and I know each leader has played an integral part, but that's what it's taken to get this message out, is having one of our community leaders here on the call, on our panel today, call the Utah Department of Health directly and request how they can begin to coordinate and offer COVID-19 vaccination. So I commend and applaud everyone on this panel. Jeannette, would you like to add anything to that? Because I know also as a community health worker, and even Valentine, you oversee community health workers. Share with us about how community health workers have been a part of the important process of educating and scheduling vaccinations.
Thank you, Heather. It is since the beginning of the pandemic with testing as well. I think the numbers of people getting testing increase in our communities because of the CHW work, because what they did in the community, they have the trust of the community. That's why we increase the numbers of people getting testing, and we advocate for the changing in policies about getting testing, because there were so many barriers at the beginning. With vaccine as well, right now, we are doing, as you were saying and Doriena was sharing, we're working in collaboration with other organizations to sign people. And what is happening is because we have the trust of the community, they starting to call in us all the time, right? We are not a big agency, but it looks like we have like a call center, because really people trust in us, right? And they call us all the time to schedule an appointment, because we do the process very easy, right? They give us the information and we have the challenge to get into the system and do all this malabares, right? All the work under the system, because it could be overwhelming, find an appointment right now in the system. I think the closest is until May. And thanks to sites like Calvary that give us the opportunity to sign people to the site, we can help so many community members. And another thing that we do is not just make an appointment, but we do education as well, because people call and said, oh, I'm afraid to have this vaccine or this vaccine. What do you recommend? And we are not doctors, right? And we have to provide that education and empower people to make their own decision, and they can come to the vaccine. With people that don't have transportation, we have to find the resources for people to have transportation to the sites. For example, we have a family that have a kid with special needs. She needs to be in the tube all the time, and the mom needs to be with her 24 hours a day, right? And she cannot come to the vaccine, and she really wants to come to the vaccine. We have to find transportation for her to come to the vaccine, but at the same time we have to provide someone that is going to take care of the daughter while she comes to take the vaccine, because at that time we didn't have the mobile vaccines that they can go to the houses, and that's why we advocate for this again. We need those vaccines mobiles that can go to the people's house when they cannot come to the sites. And yeah, it is. I think it's been a challenging month right now. We're trying to help as many people as we can, but sometimes it's bigger than us, right? Even we want to help a lot, all of our members, it is a lot, because having 150 calls every day is not easy. It's sometimes it's overwhelming for the community health workers.
Thank you, Jeannette. And I know we've spoken in other meetings how the community health workers themselves need support because of how much demand is being placed on them. Valentine, I know you have great experience and expertise in community health worker leadership. Go ahead, please share your thoughts.
Right. What I can add is I think community health workers provide knowledge that you cannot find in any book, because they are speaking from their experience. They are serving communities that they understand better, and they are available 24/7. You know, there are so many organizations out there which are helping communities, but when it comes to community health workers, we are available 24/7. Anytime. The other thing is, like for our organization that serve refugee communities, we have people who speak like 7 languages. That means when it comes to interpretation, we are able to make sure people understand the services they are receiving. We do transportation for those who are not able to do it themselves. But the other thing also, because we serve communities that we understand, that we come from, people are comfortable to share sensitive information with us in terms of their health situation, which sometimes they may not be able to share with other healthcare professionals that they don't have that much trust with. We want to make sure we serve people in a way which is culturally appropriate. So knowing the right words to use, knowing the right vocabulary is so important. And I think the other key aspect of the way community health workers are successful is when we are sharing information. Let's say we are promoting COVID vaccine. We do this during community events, things which are already ongoing. we do this when we're in a baby shower or at the birthday party where people are already there, so they don't have to do another trip. So I think those are the different ways that community health workers have been able to be successful.
Thank you, Valentine. Ed, would you like to add anything to that before I go to a question in the chat, just as we're wrapping up with this question?
Yeah, well, I think that Doriena and Jeannette and Valentine have raised some important points. And, you know, one of the biggest barriers that we've become aware of, and I should say, you know, this is a more promising time for American Indian populations, right? Because today, the Secretary of the Interior, who is a Native woman, is in the state of Utah, but also COVID did lay bare the inadequacies that exist in some tribal populations when it comes to providing health. Now, my family up on the Northern Ute Reservation, as soon as COVID hit, they went into total lockdown, and people couldn't leave the reservation, and they were discouraged from traveling from even within the reservation itself. Now, most of my family stayed safe and healthy, but down on the Navajo reservation, it was a different story because people actually had to leave the reservation to go to work. And when they went to the border towns, they brought the COVID back with them. And that aided in the spread of COVID because they were actually going to their homes, right? So isolating families on the Navajo reservation, even though they live in isolated circumstances, was not accomplished because people had to go to work. But in terms of community health workers, you know, and I know the libraries have played an active role in helping us to promote our community health workers so that they are now seen, even in the Native community, as a means by which our community people can access health information in a way that, as the others have alluded to, is culturally competent in a way, and also in a way that we understand.
Thank you, Ed. I'd like to draw our attention to the chat. This is a question from George Strawley. We do know him well as we've collaborated with him. He asks, it seems to me there is a lot to track when you are providing information about vaccines at the same time that you are working out the logistics of getting someone to a vaccination site. It's not just a matter of handing out information, but of responding to people. Can you say a little bit more about the tactics your community health workers or communities use to get all of this to happen? Ed, are you?
Yes, well, I'm the worst example, right? Because I was working on an article for the group that I work with, Trial Innovations Network, about health access. And I wrote in my article, you know, when this vaccine comes out, I'm not going to be first in line because, as Doriena alluded to, we don't know if our people were involved in, you know, in the trials for the vaccine, right? And I said, no, I'm not going to be first in line. But because I work for an American Indian organization, we were among the first to receive the vaccines. And they called me up on Thursday and said, can you come in? And I was there on Friday. I had to change my whole attitude. And I think one of the things that we're trying to do is help our people become aware of the seriousness of COVID. And those who have relatives who have had COVID are already aware of that. We're trying to make those who have not had enough experience with COVID aware of the fact that one of the ways in which our nation can deal with this pandemic that we're in is by getting people vaccinated. And so that's part of what I like to do, is encourage people to get the vaccine. And now we're even more aware of the fact, right, that for populations that might not have been vaccinated, there's a chance that the COVID could get in there, and then a variant could arise, right? That would be even more difficult for us to fight. So that's my goal now, is to really encourage people to come in and get your vaccine. And I'm finding with my Native populations, I'm not sure about the other populations, that people are paying more attention. For American Indians, it's a little easier to get the vaccines, as they are made available, but for, as we've alluded to, for some of our other communities, not so easy for a variety of reasons. And I don't know if that information helps.
Thank you, Ed. I see. Valentine, what are your thoughts on how everything's logistically getting done with education? What are all those tactics to make it all happen?
Right. I think the key is you want to have people who are sharing information with the community. They need to be people who are already trusted. Mm-hmm. And this is something you can build when COVID starts and say, oh, let me build the trust and then I can share the information. It has to be a trust that started a long time ago, depending on the relationship you have been building with community members, so they can believe that information you are giving them, you don't have any political or personal reasons to be sharing this information. And what we have been doing, like we share photos of ourselves receiving the vaccine, so they can see that, oh, if this trusted community leader have received the vaccine, there is a reason for me also to trust the vaccine. The other thing is, I remember one of the community members when I was promoting the vaccine, I think people have been watching too much social media, and this guy was telling me that there is this political thing behind the vaccine, and Bill Gates wants to be in charge of the whole country, and there is a microchip thing in, all these stories. And this guy was convinced that, people in this country wants to control the minorities, and that's why he doesn't trust the vaccine. So I had to sit down with him and have a good conversation so I can understand, first of all, where he's coming from, why does he believe these stories, and also show him that they could be political reasons of people promoting the vaccine or damaging the vaccine. But like I said, if I was not somebody that he trusted, he was just going to say that I'm also one of the politicians and I want to sell him the vaccine. So, and also you go back to the history, and some people have bad experience with what has been happening from the healthcare, the way minorities have been treated in this country. Some research studies have been damaging to those community. But again, how are you, the way you are convincing those people that this is not the situation? Of course, some of them will believe you, others will not. But I think the fact that you are somebody who have been trusted from the beginning, for me at least, it has been the key thing.
Thank you, Valentine. Go ahead.
I would like to add to that, in Utah, something different is happening right here, right? It's been a model for other states. What happened here is at the beginning of the pandemic, when our numbers were so high and the state couldn't reach our communities, they reached to community health workers. 12 years ago, we as a community health worker, we started gathered together and then we create a group of CHWs under UPHA, and we started ourselves organized, right? And then the health department, they were like allied to us, and they want to support us because we've been working together in different projects. And when they find out that we are getting together, we create a coalition, and we have that partnership with the health department. And then when this pandemic came, they knew about the job that we were doing in the community, and then came to us, right? And there was a grant to support community health workers to do the job outside in the community. And thanks to this, we have the opportunity to sit at the table where we bring all this feedback from the communities about testing, about this, what happened, the systemic barriers, and how are we are going to help members of the community to get access to all these resources, right? And then in Utah, multicultural committee was created by the government order, and in this group, we as a community health workers, we have participation in there. We can go to the group and present all the challenges that we were facing. And thanks to all this feedback, campaigns were created where community health workers participate. You know, there was many changes in the application for resources and all this work that we did together. And the tactic that we use, as Valentine was saying, is use ourselves, right? In Utah, CHWs were, they were, how do you say that? Sorry, my Spanish is in my mind. We were classified as a first line workers. And because of that, we were kind of in the first or the second round of vaccines here in Utah. And when we get vaccinated, we put those pictures outside, and community members starting asking us, as Valentine was saying, when is our turn, and how do you feel? Are you going to get sick or what? All this question, right? And people starting asking all this questions. We use a lot of social media, Facebook Live, town halls. You know, we use, for example, in Spanish, we find doctors that speak Spanish, and we do all those live Facebook media, and when we can interact and have questions asked. And another thing that it was very important was transparency. You know, for us as a CHW, for us, it was very, very important to know exactly what's going on, because that's the message that we're going to pass to the community member. Transparency, trust. I think the section, the advocacy, all these components help a lot to increase first the numbers of testing, now the numbers in vaccine here in Utah. And there is a big report in the health department website that you can check if you want. It's public, about the work of CHWs here in Utah during pandemic.
Thank you, Jeannette. Doriena, what are your thoughts? Go ahead, you're on mute.
Oh, I'm off mute.
There you
now.
go. Okay.
Thank you. I have to agree with what Valentine and Jeannette has already said. However, for me, I have been at the Calvary Baptist Church since 1993, and I've always been at the front desk or doing health issues with HIV, different health problems or health fairs, and we've been doing it for many years. So for me, the trust part, for me to contact somebody, was very good. And so for us, word of mouth is very, very important. So that got the ball rolling for the first part. And then after that, it just snowballed. And like Jeannette was saying, it is very, very important for the trust. And so we've been building the trust with our community so that they will come and get the shot, so that they will tell their friends and their neighbors to come and get the shot. Now, I've only known a couple of people that have had a reaction to it. So we tell them right off the bat, do not listen to what's going on TV. We tell them to stay away from social media, because the part that wants to downplay it and say it's not safe is not good. We want them to wear the mask. We want them to do the social distancing. Um, when they call us with questions, if we don't have the answer, we get the answer. Not only that, but for our CHWs, someone was talking about being burnt out. The first thing they learn is about being burnt out. So they teach their people that they're with about being burnt out, how you take care of yourself, both physically, mentally, spiritually, all of the above. So we don't really have too many problems with people being burnt out, because we tell them before you can help someone else, you have to help yourself. You have to be in good health yourself. And if you're not that, then you can't help others. So we don't worry too much about being burnt out. Instead, we get people to help us to help other people. And that's in all of the aspects. And with being a part of Community Faces of Utah, it helps a lot with the different programs that we have partnered with to help us to help other people. So we don't worry too much about that. The only thing that we're worried about is the ones that with the negative attitude. We have to help them to understand that this is a real thing, because we've lost some key people in our church to COVID through death. So, and we've all had family members that have had it but survived. So we have to look at it from every aspect, because the ones that have lost it, their mental state is like, well, hey, the shot didn't work. Well, they didn't have the shot. So you have to put that in perspective, as well as getting the others not to straddle the fence and to really, really take the shot.
Could
Thank
I
you.
add a piece about the trust issue, Heather? I'll make
Yes.
it very brief. It's so very important, and I support all the statements that have been made about trust. And with the American community, there has this distrust and this mistrust in the federal government and whatever comes with it, including healthcare, has been happening since 1492. Okay, but to give you some recent evidence of that, so my adopted brother, if you look in his mouth, he actually has a filling that's below his gum line, below the gum line. And I said, how come you have that? Well, the native kids from his school used to be taken to be part of experimental procedures by training dentists. Okay, so this this developing mistrust because of incorrect experimentation is something that's happened to more than just one community. And so we're trying to get over that trust. I think COVID has given us an opportunity to really help our people gain trust through the right representatives, our community health workers in the health system.
Thank you, Ed. I'd like to ask a couple questions that we've touched on. As this work is being done in each community, as each of you are integral part of bringing this important information about COVID-19 and influencing those, some questions came up as, okay, so if misinformation, if you're in a situation where you're hearing misinformation communicated, is that then, when that happens, are you going back and being able to communicate the scientific information to it? And how is that science translated so that it is, digestible for community members? Is that clear, the question that I'm asking?
Yeah, right.
Okay, Valentine, go ahead.
So like for us, when we go to present, because we don't have many scientists in our organization, but we collaborate with healthcare providers who have the science background. So when we go to present, I can present I can bring the community engagement side. I encourage the communities to participate. But when it comes to providing scientific information, I want to make sure I have somebody who is really educated in that area, because if we provide good information, that's how the community can trust us more versus us talking about something we are not aware of. And of course, you are going to have questions because sometimes community members do not understand the scientific language, and you are going to have questions so from the members. And sometimes that's how the science side and the community engagement side meet each other, so that you can use science information and present it in a way that typical community members can understand the vocabulary, the reason behind it. Yes.
Thank you, Valentine. Jeannette, you're shaking your head.
Yeah, I'm agree with Valentine. For example, with vaccine, when they open to chronic disease, they put this list of chronic disease with a language that only doctors can understand. How community members are going to identify with us, all those big names, right? It is important that the literacy of all this information go to the level where people can understand, right? And as Valentine was saying, when people, we cannot force people to get vaccine because of the history. For example, in our community in South America and Latin America, we have a story about history about all the trials and how they've been using like lab rats to prove so many different vaccines, right? And a lot of people has that hesitant, right? And as Valentine was saying, they don't want to do it, and we cannot force people to do that. The best thing that we can do is provide all the tools that the people need to take their own decision to take the vaccine, right? To give them all the information that they need and why they are afraid to do it. And let's have this conversation. If someone is hesitant to have that, I invite them to a town hall meeting, or maybe we have conversation with doctors, and via Zoom, and then they can ask, and that's the only thing that we can do. We have family members that bring their dads and their moms, but they don't want to take the vaccine. They say, no, that's not for me. And that's fine. Let's start with mom and dad, and I provide all of this information. And as somebody was saying, yes, CHW is more just than passing information, right? We do more than that. And when you provide all the tools and you have the trust of people, and they see how that flowed in the community is happening with the vaccine, sometimes they take their own decision, say, yeah, we have people that said, yeah, after everything that I read, I saw everything that you provide, yes, I will sign for my vaccine. And that is a huge thing, right? But again, we cannot force people to say, oh, you have to. No, why they have to do it, right? We have to provide those tools, and then people freely can take their own decisions, right? Because that's what we want, that people take their own health in their hands and they decide the best thing for them.
Thank you, Jeannette. Ed, I'd like to follow up with that, and I know you have some. So as everyone's shared, there's a question in the chat, which is the best way, or how is information best received? From the medical scientific expert, from the community leader, or both? What are your thoughts on how important health information is being delivered and who it's being delivered by?
Well, I'm not sure what's happening in other states, but in the state of Utah, we get a daily update on the COVID situation. We get a daily update on how many more people have become infected, how many people have been vaccinated. So we're able to see those rates, and they're pretty easy to understand, I think, if you have a TV to watch. And that's very basic information. So in response to your question, I myself like to rely on information that we get from our community health workers and information that we get from experts. And Dr. Fauci, I see what he has to say. I've developed a trust in him, and I hope that trust is well founded and well grounded. And so I think we who are here have the opportunity to become aware of that information, and then we can take that to our community. So sometimes they don't have the ability to access that information or understand that information directly. It becomes our responsibility to help do that.
Thank you, Ed. Doriena?
At the Calvary Baptist Church, we, for the last, I would say, the last month, we have taken people that are in the medical field, and during our Bible study time, instead of doing the Bible study, We've had them come in and answer questions to the people that had questions, uh, inform them of the information that people are saying or things that they're hearing, clarifying what the vaccine does, how it was formed, who's formed it, why we should take it. Uh, a lot of people were thinking, we are guinea pigs, so no, we shouldn't take it. They've even went as far as to assure them that it is safe to take the shot. So we've been really getting it not only from people that have already had the shot to the people in the medical field so that they will be comfortable in taking the shot. Um, we've got several people that are doctors that are within our congregation. So we constantly have the medical field, but we also have the people that have taken it. And then we have the people that are encouraging them to take it. So we have a few that are still sitting on the fence thinking, should I or should I not? But we're giving them all the tools to make up their own mind to come and get the shot. And I like that because um, I was one that was saying, no, I'm not going to get the shot. I'm not taking it. I don't know what it's going to do to me from past experiences of having a flu vaccination that made me very, very ill. So I don't want to be on a ventilator or any of those things. And so when I was looking at all the underlying conditions that people have, that, they should have the shot. And I was thinking like, boy, half of that is me. And I'm not going to do it because it's going to kill me. But I recently had an experience where I got the shot, not that I would have had the shot on my own. I was in a rehabilitation center because I had fallen. And so there they gave the shot, and I was expecting a bad experience, but it wasn't a bad experience. So I could tell someone else.
Looks like Doriena just cut out, unfortunately. We only have about 7 minutes left. So Jeannette, I would like to go around. So hold that thought, Jeannette. With each of the.
So we couldn't tell what they were. And I mean, they had a long list. So we had them to revise it the way we got people to take the shot, where we were entering the people into the computer. So, or giving them an appointment. So we had them revise it to a point that we could understand so that we could tell them, yes, this is the underlying condition, or no, this is not the underlying condition. So things that we've had to learn or revise over the months that we've been doing it since February has been a great deal of change. So now it's easy to get them in. And where we have it, it takes maybe a half an hour at the most, Jeannette, to get in and get your vaccination and get out the whole time. Some people stay in line for hours. So their time is very important to them. So we make it time efficient for them, and we assure them that it's okay. So now we're getting more and more calls from people that are feeling more secure about getting the shot.
Thank you, Doriena. Thank you, everyone. We have, if each of you could take just 1 minute, and just what would one final thought be that we could share with everyone here today at this conference? And perhaps it is, what else should healthcare providers know about your community and health literacy? That would be one final question, or just one final thought that's the most important regarding the topics we've shared today. And Jeannette, you were going to speak, so just 1 minute on a wrap up. Thank you.
Yeah, just add something. In Utah, someone about the literacy, about the language. One of the things that was very important for us here in Utah, the CHW section, is to understand, because community health workers are the ones that passing all the information outside the community. for us, it was very, very important that all the CHWs understand exactly the information, the language that is being used, the terms that is being used in English and in Spanish. And we bring doctors to our meeting, CHWs meeting every 2 weeks. We have this meeting with all the CHWs and we provide this information in English and in Spanish. And we provide all the terms that they can use and understand exactly, and they will be prepared to answer the questions in the community. And I just want to add that to that, and to end, just trying to understand the background of our communities, you know, the stigma that it is in our communities, and empathy. I think the key is empathy to our communities, to our cultures. That is very important. And when people have the tools and the information, they tend to have a good decisions for their own health. And that's the thing that I could add. Empathy.
Thank you. Thank you, Jeannette. Ed, briefly, 1 minute, wrap up, please.
Yes, I support that, but I also say get to know the communities, and please don't make assumptions about your community. So I have one kidney and I'm a diabetic, and I got dehydrated one day and I had to go to the emergency room at one of the local hospitals. And when the doctor finally came at the end of my visit, he says, "So you like to drink, do you?" He thought I was an alcoholic coming in for service. And excuse me, I'm a very well-educated person. That offended me, but not enough, because I was smart enough to know that I need to go through the visit. Okay, so please don't make those assumptions. And someone mentioned something about transplants, and I'm sorry that we can't address that. I'm the closest on the panel to that because I've had a few things removed. And I see that COVID is good for my health, at least the vaccine.
Thank you, Ed. Thank you so much. Valentine, 1 minute thought to wrap up, please.
Right. There was a question in the chat talking about how do we manage to work 24/7 in our community organization. Well, first of all, it's not one person. We have multiple volunteers. The other thing, like I said, we deliver our messages through ongoing community events, which are already planned, already happening, and we take advantage of that and to deliver the message. So that's why we are able to work 24/7. So one thing I can share is the key is to collaborate and work with community leaders who understand their organization, but not only work with them, but also listen to them and be able to implement changes that they are suggesting. Because one thing that I have learned from COVID-19 is that when it comes to minority communities, we have these health disparities going on. But believe me, if we are in a boat and we have a hole on one side of the boat, all of us are going to sink and we are going to die together. So my final thing to share is that taking care of healthcare system in minority communities is going to help all of us.
Thank you, Valentine. Doriena, last thought, 1 minute about wrap up, 1 minute.
Wrap up. Okay. Number one, our community really relies on the church. So the clergy plays a big part in telling their congregations to get the shot. So we rely on our clergy a lot to transform or to relate the message out to the congregation, which relates the message out to their family, which relates the message out to the community. So by word of mouth is a very good way, and I appreciate that. To get the shots from us, you just need to call one of our numbers and we'll sign you up, and you'll go to 1090 South State Street, get your shot, and be on your way.
Thank you, Doriena. Thank you so much, everyone. Ed, it sounds you wanted to say one more thing.
No.
Okay.
I endorse everything that's being said.
Okay. Thank
I'm
you
gonna-
so much. Oh, go ahead.
Oh yeah, Heather, I just thank you everyone. Fantastic panel, excellent. Thank you all for the work that you're doing. Really, really important and valuable, and making a big difference. With that, I do want to let everyone know that the session is going to end now so that we have enough time for everyone to get into the next session, which will start in 10 minutes. A reminder that if you are interested in the continuing education credits that come with this session, an evaluation will be sent at the end of the day, and that will be the way that you can begin to get that. So thank you again. We appreciate your time sharing all the work that you're doing, and thank you to our attendees as well.
Thank you.
Thank you.